hepatitis A virus, if it is present, we call it infectious hepatitis. As I told you, that infection is very commonly seen to these people who has a habit of going out, particularly in a place which has a very poor hygiene. So before we want to select a restaurant, make sure you know the restaurant is very good, a nice place to eat, and it is having a very clean kitchen. Otherwise there is a chance that we can get a hepatitis A virus infection. This infection, when it occurs, patient should get a jaundice. Sometimes the jaundice can be very serious and the patient may look very ill, though the patient will get over this illness and ultimately there is a quick spontaneous recovery. So how to diagnose this condition? So you get a history, the patient is going out, had a meal in a restaurant, then the patient has come back after 2 to 3 days or weeks, depending on the incubation period. The patient will get a jaundice, patient will feel very ill, the color of the urine will change, you can see the patient eyes looks yellow. All these features will suggest the patient has a viral hepatitis. Of course, you want to do the liver enzymes and IgM study, and after some time, maybe after 2 to 3 weeks, when the viral antigenic load will come down and the patient will get a recovery. So antigens also will come down in the serum. You may not get antigen at all, and it means the patient has a recovery. Now, good news about that, I already told you. Hepatitis A virus infection never ever produce a carrier, never ever produce a chronic disease, and never produce a hepatocellular carcinoma in most of the cases. So you can assure the patient that the patient would not get this kind of dangerous complications. So key point is eating out, having a jaundice, and after some time the jaundice will subside. Now we are going to the next important one, which is the most dangerous type of hepatitis A virus infection. Hepatitis virus has got 4 different kinds of enzyme in their viral code. At the top you get a surface antigen, then inside we get a core antigen, then we get a pre-core antigen, and we get a X antigen. So if you really want to draw a virus, hepatitis B virus, at the center you are getting an antigen which is known as a core antigen C. Then around this antigen you are getting another antigen which is known as pre-core antigen, which is E. Then on the top of it, surrounding it, you get another antigen which is the surface antigen. Some of the viruses contain a dangerous antigen again inside, which is known as X antigen. If the X antigen is present, there is a high chance of hepatocellular carcinoma to this patient, because it is a X antigen which can produce a carcinoma in a patient who is suffering from hepatitis B virus infection. So remember one basic thing about the antigens, that when the patient has an acute illness, all these antigens are present in the serum and you get antibodies against all these antigens. So if it is acute illness, you get IgM antibody against all these antigens. So technically speaking, if you really want to diagnose a patient with hepatitis B virus antigen, the acute phase, you can check for all of these antigens and the corresponding antibodies. But remember one thing, it is always important for in a clinical practice to do it in a cheaper way. So in that case, the most important antigen that is used for the diagnosis, which is readily available, is hepatitis B virus surface antigen. That is why most of the time, if you want to diagnose a patient with a hepatitis B virus, we check for the surface antigen. Did you get it? Technically, you can also check for E antigen and C antigen and X antigen. You can do that, but their titers are not that as high as surface antigen. They are present, but very difficult to detect from the serum. So what is easily available and to see that? Surface antigen. And remember one thing, it is a surface antigen which can be transmitted from one person to another person, so the infection can spread with the help of the surface antigen. So how long the surface antigen stays in the serum? Yes, look at that. It declines to undetectable level in 3 to 6 months. Suppose it is present for more than 6 months. What do we call that? A carrier stage. Carrier. C-A-R-R-I-E-R. So this is a curve for acute hepatitis B virus infection. So you can look at the curve very well. This is a point when the patient can get infection, and this infection the patient can get through blood transfusion or from mother or from sexual contacts. The infection will stay in the liver and in the human body for some time, where it will grow and grow, and then suddenly it will cause disease, usually after 4 to 6 weeks. This is the incubation period, and during this particular time the serum transaminase levels will slowly increase, and then you get a various antigens in the serum: hepatitis B E virus E antigen, hepatitis B surface antigen, hepatitis B virus DNA, and you see all the antigens are going up. And when the antigens are really highly present in the serum, and they present in the serum with a very high amount, the patient will have symptoms of jaundice, and that is a phase of acute disease. So can you tell me, in the acute disease, what are the serological finding could be? You will get jaundice, you will get excessive level of hepatitis B E antigen, hepatitis B virus DNA, and hepatitis B virus surface antigen. What else? Yes, you also get a antibodies, IgM antibody against these antigens. What else you get? You also get a serum transaminases, which are the serum marker for the liver disease. So what are these enzymes? AST, aspartate transaminase, and ALT, alanine transaminase. Now look at the curve again. You can see that you can see the antigen loads are coming down, and by 4 to 20 weeks, it is almost nil. And what you see here now, also the IgM antibodies are coming down, but they are taking a little bit more time. Of course, they are protective, so they will take some time to see the last bit of antigen is gone. And as it is going down, you can see the elevation of the IgG antibodies against these antigens, the surface